Donald Trump was visiting Australia and had a conversation with the Prime Minister, and he had some pretty interesting things to say about the healthcare system in Australia and how he felt that it's actually better than what we have in the United States. Take a look.
Right now, Obamacare is failing. We have a failing healthcare. I shouldn't say this to our great gentleman and my friend from Australia, because you have better healthcare than we do. We're going to have great healthcare very soon.
Wow.
Wow, that's interesting, because in Australia they actually have government-funded universal health care. Now, some people do have to buy private insurance to cover certain things, but just to give you some details, Australia has a universal government-funded healthcare system called Medicare. Okay, so citizens there must purchase private insurance for some medical services. The system is partially funded by taxes, including an additional tax on wealthy Australians. So literally the antithesis of what Republicans, what the GOP is pushing for. And it's interesting because we always have these conversations about whether or not Trump even knows about the legislation, the details about the legislation that he pushes for. And it's clear, I mean, just from this one video, that he doesn't. Because if you knew what was in this legislation in the United States versus what's going on in Australia, then you would know that your statement made absolutely no sense whatsoever.
First of all, are we going to start referring, before we speak to someone, do we say our great gentleman? Is that a thing that we're now going to do?
It sounds fun.
Do you have something to say first, our great gentleman, Jimmy?
I have something to say. What's another word for gentleman?
Good sir.
Yeah, oh, that's it, our good sir, great gentleman.
Good sir, yeah, good sir, great gentleman. If we had universal health coverage here, I'm pretty sure you would still be able to buy extra insurance.
Yeah.
Like that thing would still exist, so people who want that would still be able to have it. And that would create another issue of some, but again, what we're looking for is a base of services, but a base that's a respectable base. Like we can't just have a base where you're like allowed to get sick and go to and then buy Robitussin. Like that's what Republicans.
But what about even sick babies we would cover?
We would
do we really want to do that? Because babies get sick a lot.
I don't know. I was reading the Washington Times, and they're like, "That's bullshit."
Now, I guess in this story, what's not in here, and this is, which are the services that they have to pay extra for? I'm playing devil's advocate. If it were, if it's oncology services, then that's not enough that they're providing. But I bet it's not.
But if it's like Viagra and hair transplants, maybe that should be additional.
Right, but that's okay, right? We want to, but that baseline has to be reasonable, a baseline that keeps people healthy, not only healthy, but keeps them financially secure should a significant medical issue hit someone in their family. It's not complicated.
So I remember.
I'm sorry, but in answer to your main question, no, he doesn't know.
He doesn't know, and that's the amazing thing. So this vote that happened in the House was much more about politics versus policy, because for Republicans, and it's amazing to me because I think it's bad politics, because so many Americans are up in arms, both on the right and the left, about what's happening right now. Anyone who's paying attention is not happy. It doesn't matter what your political ideology is. It's clear that there are some serious issues with what the House passed. But in the perspective of these lawmakers, it's like we gotta show that we're doing something. We gotta show that we've achieved something. Trump is obsessed with showing that he has achieved something. And it doesn't matter what the wording of the legislation is. It doesn't matter what it includes or what it entails or how it's gonna impact Americans. They just wanna point to it and say, we did something.
This plan, like you said, Anna, cuts $1 trillion in taxes from the wealthiest people in the country. So when people say, hey, Medicare, how are you gonna pay for that? Right now, we're giving the richest people in the world who don't need a tax cut, $1 trillion tax cut. That's how you could pay for it, right there. You could pay. One more thing where you said that this is bad politics. This is bad politics for them. The Democrats should have a bloodbath right now going in 2018. They should kill the Republicans. I might be slightly off by 1, but I think something like 24 Republicans in districts that Donald Trump did not carry voted for this bill. So now that means they're vulnerable because they're in districts that Hillary Clinton carried and they voted for this healthcare plan. And if they can, so they should be able to flip those seats to Democrat, and then the Democrats take over the Congress.
$800 billion cut from Medicaid. $800 billion cut from Medicaid. And then you got Kevin McCarthy going on TV and saying, well, no one on Medicaid will be cut. That's because people who are on Medicaid go off Medicaid, sometimes with death. But it will be much harder to get on Medicaid. You can't cut $800 billion from a program and not have it affect someone.
I know.
So, you talk about it being bad politics, though. This is what the right wing does. Because if you remember, during the Clinton impeachment, everyone knew that the country was not behind impeaching Bill Clinton. In fact, the public opinion polls were the other way, and that it said that the Republicans were going to take a hit politically if they did it anyway. You know why? Because the Republicans serve their base, whereas the Democrats mock their base.
Right, and I just really quickly want to jump in before everyone forgets this component of the story that I think is important. So you had asked the question about what the public insurance program in Australia does cover, and I think that that's really relevant. We did look into that prior to the show, and I want to pull up that information. So there are 3 healthcare components of the Medicare program in Australia. There are medical services, including visits to general practitioners and other medical practitioners. That's all covered. Prescription pharmaceuticals. Covered, yes.
Oh, that's a big one.
Hospital treatment as a public patient. The latter is jointly funded by the Australian and state territory governments. I want to be clear about something though. If you are at a certain income level, the government emphasizes that you need to go toward private insurance because they want to take, some of the financial burden away from the publicly funded insurance. So there are people that rely more on private insurance, but it's based on income. Also, other health services provided by national and state territory government, population health programs, community health services, health and medical research, Aboriginal health services, mental health services
is covered.
Oh, mental health services are covered. That's amazing. I mean, here in the United States, we only talk about mental health when there's a mass shooting, and we want to use that as a scapegoat instead of talking about guns, health workforce, and also health infrastructure. So the
sound like a bunch of snowflakes down there.
The government, the Australian government responsibilities include health service funding, regulation of health products, service and workforce, national health policy leadership. So these are bullet points, and obviously these are, if we were to sit here and explain every single little thing, we'd be here all day, but they cover a lot. And so it's not like basic insurance where they're like, if you get sick, we might allow you to come see a doctor and you'd only have to pay a $50 copay for it. It's actually pretty comprehensive.
We'll give you a splint, not a cast.
Yeah, that kind of stuff.
So you're telling me in Australia, they force some people to pay for other people's health care? That's what's going on, because that's how the right wing frames this.
Right. Well, there is an extra cost for the wealthiest people in Australia.
Oh my God.
People don't like health care anywhere because they have to go to it when they're sick. Right. So it's a bad time no matter what. Nobody in Canada is like, well, I'm getting sick in Canada. I love the flu. I have gout. I was so happy. I got to go to the doctor, and that's a pleasure in Toronto, eh? To your earlier point, and Jimmy, you said it's politics over policy, and obviously, look, it's Congress, everything. There's politics because they spent now since 2011, whenever Obamacare passed, they've been saying they'll repeal it. So this is politics. They had to deliver on a very basic promise to a base voter that they, as Jimmy said, are super loyal to. But I disagree that it's politics over policy. It is a combination. This is policy. They are very comfortable with a health system in America where millions of people are uninsured. That's policy. They think the private sector should take care of it, period, end of discussion. That's policy. They're proud of themselves for that.
So I agree with you that there is some portion of the House that does not care. They know what the policy is and they're okay with it because they just don't think the lives of Americans who can't afford private insurance don't really matter that much, I guess. But the reason why I think that it has less to do with policy is because they rushed this vote. They rushed it so quickly. The government. The budget office, the CBO, there we go. The CBO didn't even have a chance to analyze it. They didn't care, right? A lot of the representatives didn't even read the legislation themselves, and we have evidence of that, okay?
But also, I love those questions because suppose they'd read it. They don't know what it would have meant if they'd read it.
Well,
and I'm not making fun of them. We don't have the best and the brightest there, right? I mean, we've seen it. Look at their hair. right? You know these guys aren't serious people. Like just everything. So there's some smart guys there, but there are also, this is not a job, and partly because of the nonsensical way that we elect them, and because if you get the nomination on either side, generally, well, that's it. Depending on whether it's a safe blue seat or a safe red seat, that's it. So no, of course they didn't read it. I don't care if they read it.
That's insane. I do care if they read it, and that's actually a separate story that we're gonna get to in just a second.
But the reason that it's still policy, even though yes, everything you say is true, what this is policy-wise is it got explained to them in one sentence, which is, and that sentence is basically, states will be able to do whatever they want, which means states can do nothing. And that's essentially what this will allow. With some very bare minimums, this will allow states to do essentially nothing. That's what they want, a system where people don't have, where the market takes care of itself. And that's it. So they would not say that we don't care. They would say, if I'm going to defend them, they would say the last people who should be involving themselves in healthcare is the United States government, even though we acknowledge that the United States government should take care of its soldiers. They would acknowledge that. So it's some role that they have. The people most vulnerable to getting shot and torn apart, the government can handle that. But the population in general, government involvement would be a mistake. They don't want government involved. They don't want government to do anything. So this bill is ideal for them policy-wise.
Except they did exempt themselves from this legislation, so they do want the government to provide health care for themselves.
Right, for them and their families. As long as they're protected, that's all that matters.
Yes. Our journalism drive is almost over. It ends in Trump's first 100 days. We need to hire more reporters and more watchdogs. Let's do that right now at tytnetwork.com/go.